So just to tell you about St. Luke's, if you don't know about St. Luke's, we are the largest private employer in Idaho. We have 7 hospitals. Our main hospitals are in Boise, Meridian, and Twin Falls. We have smaller hospitals in Mountain Home, Jerome, McCall, and Sun Valley. We have over 150 clinics and outpatient facilities in the Treasure Valley, which is the Boise area, Magic Valley or Twin Falls, Eastern Oregon, Central Idaho, and we just recently opened up children's orthopedic clinics in Pocatello and Idaho Falls. So St. Luke's really reaches out. I work in the IT department at St. Luke's. It's kind of an umbrella for a lot of things. We have a staff of over 500. We are primarily based out of Boise. We have a little bit of outlying staff at remote areas for a little desktop support, but primarily we're all based in Boise and do it all remotely there. Here's some job titles that we use. Application analyst, which is what I do. I support the EMRs, or the electronic medical records, in our outpatient facilities. We have several project managers. Project management is a big deal in healthcare IT. We have IT security. We have people on the reporting and database team. We have server engineers, desktop support. They're the people who are going out and helping you with your printer if it's down, or trying to figure out what's going on with your hardware. Help desk, or the people who take calls from users who are having trouble. We have an interface team. An interface is big in healthcare because we have X-ray machines, we have EKG machines, we have all these peripheral devices that need to record data and feed that into our systems. And so figuring out how that works and get correct data in and efficiently is a big deal. We have a large training staff, and they develop workflows that are sent out to clinics, but they also have training classes that physicians and nurses have to take before they're allowed access to our EMR and allowed to practice. They have to take these classes so they know how to use the program itself. We have clinical support people who are out in the clinics daily with users saying, what are your issues, what do you need that we don't have right now. We have business analysts who figure out, what do we have from an IT side, how does that incorporate into our business model, how do we make that all work together. And we have many directors, and we have many layers of management. It goes up to CIO. Some of the current projects we're working on at St. Luke's, we just kicked off a program for a new EMR implementation in our hospitals. We're going to start with one, and once we get the bugs worked out of that one, we will roll it out to our other hospitals. It's a major undertaking. We have about a 2-year time frame. Right now we're on requirements gathering phase, and so we brought in a staff for that, and they're going to just have this large time frame to figure out what do these hospitals need? What do these systems need to do? Think of it like if you were asked to build a web page for a shoe company, and that's all the information you have. You think, well, I've got shoes, I kind of know what shoes do, but the odds that you're going to build something that they actually need are pretty low. So going out and doing that requirements gathering of tell me exactly what your workflows are and exactly what you need are just really involved. Like I said, we do have staff for that, but we're going to bring on some contractors also who have specific experience in the EMR. And once the project goes out, we will likely need more people. And as the contractors we will need to fill those spots as well. Another project, we recently acquired a rehab hospital called Elks, you may have heard of, up in Boise. It's a rehab hospital plus about 50 clinics, and we just onboarded them beginning of October. We brought on 2 specialty EMRs as part of that. That's been a huge project for us. We have our main EMR that we use is called Epic, and we have an upgrade that we're starting. Right now the meetings are going for it. We'll start building it in January and expect to be done around May. EMRs are not just a plug and play. There's a lot of work that goes into upgrading these, implementing these, a lot of manpower. And then we also have smaller initiatives, things that each one of us individually work on. I have specific projects and work groups that I'm part of. I can talk about that for something else I've got coming up. But things that users say, you know, when I'm in the clinic and I'm with my patients, I really need to see this. I really need to do this, and there's nothing there. And we work on that, or we work on issues of this just isn't functional for us, or it's broken, things like that. So that's kind of what I do during the day. I gotta watch my time here because I get really excited about Health Informatics and I just get talking and I'll be here all day. So I'll try to watch it. Health IT versus health informatics. I wanted to clarify this because I thought this was confusing when I was a student. People talked about, oh, well, we need a lot of health IT people. Health IT or healthcare IT is more specifically the hardware systems, installing software, the networking people, the security people, and the software developers. So a lot of EMRs are developed through vendors now because of constantly changing government regulations. The more homegrown EMRs that we have with legacy systems are just not really up to par. And so most of it's done through vendors, but this is all more the IT side. Traditional IT, you would see a lot of this in just whatever field you're in. Health informatics is applying these tools. So I think of it like true health informatics. You have Microsoft Word. That's being programmed up in Washington. They're making Microsoft Word. Let's say you have a project and you need to create some massive mailing. So you're going to go into Microsoft Word, you're going to go to envelopes, you're going to go to labels, you're going to go to mail merge, you're going to use all these pieces of the software that's already developed, and you're going to pull it together to make it do what you need it to do. That's health informatics. We take the hardware, we take the software that's been developed by vendors, and we take our knowledge of healthcare, we pull it all together to make what our users need. There's very little programming, coding done on my end, and I would say a true health informatics job. There are, if you come to smaller towns, they're kind of a jack of all trades, and you're going to do this and you're going to do a little bit of everything. I don't do programming. I don't fix people's network. But if I was in a small place, I probably would. We have lots of people on our staff that do this, though. Health informatics uses something called decision support, and that's a way that we can help the physicians and nurses make better healthcare decisions. And so maybe we have a tool that says, hey, I noticed you just placed a prescription for this medication. Well, Dr. So-and-so over here placed a different one that that doesn't work well with that medication. Maybe you need to consider prescribing something else. Or decision support that says, your patient has these medical problems, recommended treatment is such and such. And so as part of health informatics, we develop the logic within the system to go and look through the database, look at those patients and what their specific situations are, and try to help the doctors with making good patient care decisions. There is a lot of data analysis in health informatics. We try to get everything in discrete fields so that we can just really grab that data. You might hear a term called big data analytics, and it's really just grabbing all that and what can we do with it now that we have it. And a big piece of that is reporting. We have these dashboards for physicians that we put out reports that says something like, based on what you've done the last month, only 20% of your patients who smoke have been counseled to stop. Your peers are at 60%. Maybe you want to catch up to your peers. And so we have those kind of reports. We also have a lot of government reports that have to be done. We have a whole reporting team that focuses on that. And then we have reporting tools within our EMR that users can develop their own, like they want to maybe see how many other patients haven't been in the last year, and they can develop their own reports. Health informatics, a big piece is implementation. If you can get any experience in implementation, it's pretty golden for any kind of EMR. A lot of that was the systems analysis class lines right with that. And health informatics, I just put at the bottom, is really integrating healthcare knowledge. So think of it like a big trifecta Venn diagram. You have your IT hardware, you have healthcare knowledge, and you have an understanding of the laws that govern all those things, and they all meet together in health informatics. Got a lag here, sorry. While this comes up, I just want to give you a little bit of a history on EMRs or electronic medical records. I've got pictures in the next one, so this is how we all started with these really long rows of medical charts. They are a mess. If you need something up in the ER, they would have to page down to the medical records unit. Someone's got to go find that. Hopefully it's filed in the right place. Hopefully the right papers got shoved in the right chart. It needs to get up. Maybe that patient was seen last week in another hospital, another city. Great, how do we figure that out, that they were there, and how do we get their information in a timely fashion? And and it's just not good at all. But for some reason, healthcare is like one of the last holdouts for going digital. And so there was a study published, it was like 5 to 10 years ago, I don't remember the exact date, but it said that there are an estimated, I believe, if I remember my numbers right, 98,000 deaths a year from medical errors. And the government said, we have a health crisis on our hands. This is huge. And we think a lot of it is due to this garbage. We need to have streamlined data that's more accessible. About that time, we also hit the recession. And the government said, we need to save some money. How can we save money? Well, they looked at healthcare. It's the #1 industry in the United States, and it's the #1 cost for that our GDP money goes into is healthcare. And they said, we need to cut down these medical errors. We have a lot of duplication going on. Patients going over here and having these tests done, and then he goes over here, has the same test done. Right hand doesn't know what left hand's doing, and we got to just take care of this. He said, we want everything to be digital. The health system said, terrific, so do we. We don't have any money for it. So as part of the 2009 American Recovery and Reinvestment Act, the government said, okay, we're going to give you some money to invest in these EMRs. They have to be certified. They can't be some little program that your brother made in his basement that you scan a paper to and put it on your desktop, and now it's an EMR, it's digital. So it needs to be certified. There's a huge program called Meaningful Use. If you're a health informatics student, if you don't know about it, learn it, love it. It's where the government says, okay, we're going to help you pay for these, but you got to show us that what you have is worthwhile, that we're getting our money's worth. So there's these big checklists. It has to be, you have to prove that it's safe and secure, that your data is safe and secure, that you can transmit it securely, that you have a patient portal that people can get on and see their own information on. You have to have, there's certain measures, like 100% of your patients have to get a printout of their, summarizing their visit when they're done, and you have to counsel so many people on stop smoking, and so many of your patients have to access your portal. And so there's all these measures that that they have to do. The government said, we're going to give you this much money for about 3 years or so, if you get your EMR by then. If you don't get it by then, we're going to give you this much money. So we need to get going. And they're going to decrease it, and at some point, they're going to flip it also and say, and if you don't start doing it by here, we're also going to cut back the amount of Medicare payments. The older people have the government insurance. We're going to cut back how much we're paying you on their treatment. And so it's really a push to get people going on that. So we're in the middle of that right now. Everybody is. And it's a huge deal. There's a huge amount of resources and time spent on it. The more you know about it, the better. So right now we're kind of at this stage. Most people have an EMR now. We're right now trying to get a lot of physicians onto tablets. They really want tablets, laptops, things like that, so they can be mobile, smartphone access to patient records. But we got to make sure that what they're accessing is done securely, that if they're entering data, that's sent back to our servers appropriately and securely. So there's all sorts of issues around that. But like I said, most people have one. They're trying to either transition to a better one or would like to, but they just don't have the resources at the moment because of other things that they're working on, such as meaningful use. Some of the workplaces, you'll find health informatics. These are the primary ones. Hospitals is probably the top one. Clinics, EMR vendors, so the people who are writing the software. Consulting companies is another big one. Like I said, if you work at a smaller hospital, a rural hospital, or clinic, you're going to be doing a little bit of everything, which is really, really great experience. Some that I've also heard of that probably a little less opportunity in right now are pharmaceutical companies, insurance companies, government agencies, and research companies. Hospitals is probably number one though, for a true health informatics program. There we go. Sorry, that was off. Some challenges for HR. The number one challenge, if you asked CIOs, is finding people with experience. It is really, really hard to find people with direct experience. We have a team member that's leaving right now. He's transitioning to another team. We're divided up into different groups at work. And he's transitioning to a different team, take a leadership job. And he is leaving a hole. And he's got a lot of IT background. And our team is comprised of people with healthcare background and not a lot of IT, and IT people with not a lot of healthcare, and we really complement each other well. And so we'll probably look for someone to backfill him with solid IT, because we really need that mix in our team. But we were sitting in a meeting, and we said, okay, we need to bring in somebody that has his level of knowledge, both of IT, but also our EMR. And our manager said, where are we going to get it? There's nobody around here that has experience. And so what they end up doing is hiring at a base level people who look promising in interviews and who have relevant experience for what they're looking for at the moment. If we're looking to fill a hole, like we need someone with real clinical knowledge, we're going to go find a nurse who, it seems like she kind of feels comfortable with computers, and we're going to teach her the IT side of it. Or if we're lacking in the IT side, we're going to take the IT person and try to train them on healthcare. So that's where we're at. If we found anybody who had actual experience on our specific EMR, it would just be the game over. That's it. They're it. But it's really hard for us to find that. It's kind of an industry thing right now. There's so much need for health informatics people, and people just aren't really trained up for it yet. Another challenge is rural locations. I went to a health informatics conference last month in Sun Valley, and it was primarily CIOs from rural hospitals in the area. And there was a discussion about hiring from their perspective. And they said, frankly, we have a really hard time finding people who want to live in a small town for the pay we can do. And there's just no getting around that. The smaller area you live in, the smaller place you go to, the pay's lower, and it gets bigger the larger place you go to, but then the cost of living is also larger. They desperately need people. They would love somebody to come, but they have a hard time finding that. Now, if you are willing to go work at a place like that and you can get in contact with them and get a job, 2 years there, you have done everything there is to do, and that is really fantastic experience. So think about that as you move along in your college career. And then the last thing I put on here was retention, and that is primarily because there's such a fight over people who know what they're doing. And so it's hard to keep one person in place when they can just leave and or hold over for more money somewhere else. At St. Luke's, we started with our primary EMR in 2011, and after about a year, everybody was certified on our EMR, had a lot of experience, and a lot of people left because the pay was better out of state, or they left for consulting companies when the pay is like triple. So St. Luke said, "Ooh, we got to do something about this," and they did a nationwide survey of pay and brought the pay up to that level to try to keep people better, and it's been a lot better since then. So trying to hang on to people because there's such a fight for workers right now. A couple of changes in health informatics that are coming up that are really going to impact the field. The first one is the Department of Defense. They have I believe it's a kind of a homegrown EMR that's not any good, and they realize that. And so they put out a bid, I think it was in the summer, $11 billion for a 10-year project. They'll implement it in stages throughout. Right now, the EMR vendors are partnering with hardware vendors. So Epic is partnering with IBM. There's an EMR vendor called Allscripts that's partnering with HP. And they put bids on the Department of Defense contract. Now, what that means for you, if you're a health informatics student, is that as this kicks off, and I think they're going to announce who gets the bid pretty soon, and that'll probably be another year or two before they actually get going, is they're going to need a whole lot of workers, because health informatics isn't just, okay, we're going to come, we're going to implement, and we're done. It's really a long-term maintenance thing, long-term development. It's not a temp job. They're going to need a lot of people, and they're going to get that from people who either don't have experience that they're willing to bring in, or they're going to pull people out of their current positions, which is going to leave holes all over the United States where people go to the DOD, and now there's all these open positions. And That's going to be a huge deal. The other thing is, as the meaningful use program wraps up, health facilities are projected to be able to focus more on optimizing their current systems, making them a little better. Maybe need some more people to do that. Also transitioning to another one. Most surveys show about 50% of hospitals hate their EMRs. I think Fort Smith is one of them. And they would love to transition, but they're so invested and involved in meaningful use right now, they feel like they're stuck. So as that winds down, they're going to look at transitioning, and then you're talking about whole other implementations of EMRs. What you can do now. Here's my last slide. I'm just popping through. If you're not a health informatics student, but maybe you're interested, maybe you don't know, they're probably doing registration for spring right now, I would imagine, or soon. So sign up for a class. I think we have some great new professors, and they would love to have you in class. See how you like it. Other than that, if you're currently a health informatics student, the number one thing I would say you can do is try to get a job in healthcare. Understanding healthcare is absolutely vital for a health informatics job. They'll take people who don't know it, but it is so, so important. Our EMR vendor brings on CS students from, well, they're based in Madison, Wisconsin. And they bring in CS students after graduation from University of Wisconsin. They bus them in waves. And the first 3 days is nothing but healthcare training. It's a crash course in healthcare because most of these guys don't know, or women too, don't know healthcare. And they say, this is the number one thing, you got to know it. You got to understand it. If you don't know your client and what they need and what the special things are about healthcare, you're going to fail in what you do. So I know the healthcare informatics program has healthcare classes through the healthcare administration division, and that's why it's super important. If you can get a job in a clinic doing a little IT, even better. Important enough hires, round the clock, people to register patients at the ER. I know it sounds really simple, but just getting in there and understanding what the workflows are, what people do, is really, really important. Also, if you can get any kind of experience in IT, if you don't have it, I know a lot of students in these programs have some sort of IT background, and that's great. If you don't, try to get some sort of experience, whether it's an internship or whether it's a part-time job. Go to clubs like this. Go to all networking and learning events you can. It was the number one thing I did while I was here. Really valuable. I had 3 internships my final semester simultaneously, and it really helped me get a new job, or get a job right after graduation. Go and talk to the speakers. Don't just come and listen, which is great, but you need to be interacting with them. Let them know who you are. Let them know where you're at, what you're interested in, and things like that. And networking is really important. Look for any internships. I saw Dr. Parker posted on Facebook yesterday a couple of health IT internships, which is really exciting. I love to see that. When I went to the Health Informatics conference, the CIO said, we would love interns. And that's the small rural ones. Now, I could talk to the CIO at St. Luke's who happened to be there. He has no control over hiring or interns because he's just like, 7 layers of management ahead of where that's done. But the rural CIOs are directly form their teams and hire. So they said they would love interns. The main, complaint they had was that they recognized that students are asked to have a meaningful project, and they said, the problem is our projects last way more than a few months, and we just really need people in there to just plug and chug and do the work. Well, it might not sound very exciting, but if you can just get in there and you can show you're a hard worker and you get some familiarity with their systems, you're in and you're on the team. And so look for any kind of internships either within school or outside of school, maybe over the summer, depending on your schedule. My last semester, I was taking 12 credits. I worked 30 hours a week and I had 3 internships. So don't tell me you can't do it, because it can be done. Also, subscribe to industry blogs and read about current issues. If you can go in and talk to a CIO and say, hey, where are you at in meaningful use? Have you tested for stage 2? What are your current HIPAA policies? They go, you know what you're talking about. You understand. It makes a big difference when you're interviewing. And I can't express how important interviewing is. We have people that look great on paper that come in and just interview really poorly. Go to any college of business. I know they have interviewing workshops and things like that. Go to any of those you can. Really sharpen up your interview skills. Work on how you sell yourself if you don't have experience. Here's what I bring to the table, and here I might not be exactly what you're looking for, and this is for any job, BI, whatever, CS. Here's what I bring to the table, and here's why it would be good for what you're looking for, even if what you're looking for isn't quite what I have. So sharpen up that. The last one is a group called HIMSS. It's, let's see if I get this right, Health Information Management System Society. It's a national organization for health informatics. You can get a student membership for $30 a year, which includes a state chapter membership. Right now we don't have an Idaho one, but we're right in the process of developing the charter and getting that form together. Now, how great would it be if you're a health informatics student, you go to a HIMSS chapter meeting, you're in a room with 20 CIOs who make direct hiring decisions. That is some valuable time well spent. So the other great thing about HIMSS is you can go on their website, you can look at, it's like HIMSS.org, I think. You can read about current issues, you can look at resources. There are emerging professionals sections. If you have a membership, you can watch webinars. They have topics like, how do I get experience if I don't have experience? And what are some things for a resume that employers are looking for? Some really good tools. Some of it's free and some of it you have to be a member, but like $30 for a student. So I found that really valuable. But really anything you can do now as a student, don't just wait till you graduate to kind of get on this stuff. You really should be working your whole time right now to get a job. No matter what program you're in, work all the time right now and to make it happen, and you'll be successful that way. So, like I said, I just sit through this stuff. I love talking about this stuff. So, any questions? Yeah.
So, I guess put it on a small scale. If like a small doctor's office that's still using file folders would try and upgrade to a system like that, how much would something like that cost?
It totally depends on what kind of system they are and how complex it is. A lot of the smaller places use really simple systems. The one I'm on is one of the most expensive systems. It's really complex, but small doctor's offices can't afford those. I can't tell you the exact number because I don't know, but at the very least, tens of thousands, I would imagine. The system that we're on is in the tens of millions for us. Yeah.
What would you say is the most rewarding thing about your job?
Good question. The thing that's most rewarding to me is just that satisfaction of having something work. And maybe you know that from when you're doing like a web page or coding something, and you get it all done, it's not working, and you tweak it, and all of a sudden it works like, yes, got it. Just that rush of, you figure it out, and I love that. And I love being able to see, we have work groups, one that I'm in a specific decision support group, and physicians come and they say, okay, we need a tool built that, one particular one we are working on is for a pneumonia vaccine. It should be for, and this is where our logic comes in, it should be for 65 and older, unless you have these specific health conditions, and then you get it younger, and you get a certain number of shots, they're spaced a certain amount apart. We need the system to tell us all this. And so we worked on that for months, and finally got to work, and it was so exciting, and exciting to see it work in action. I have one coworker who came from just a straight IT background, and I think he worked more on just the really granular IT pieces, and he said, I just love working in health informatics because what I do directly impacts patients and helps them, it helps the users in the clinics, and I see results right away. He says, I can write some little code in the background for some software program and then send it out, and I don't know what happens, but I can develop something in the health informatics system, and I can see tangible results the next day of it looks different, it works different, and so he's real fun to talk to. He gets really excited about it. So there's lots of different answers to that. For me, I just like the rush of being able to figure out problems and problem solve.